The modern medical establishment recognizes a variety of different types of headache pain. However, before we look at the different kinds of headache, there are two main categories of headache pain that you should be aware of. Primary headaches, these are the headaches most of us experience on a day-to-day basis. They are called primary headaches because the pain is not a symptom of another physical disorder. Ironically, they are often called benign headaches, although headache sufferers would classify them as anything but benign. Secondary headaches, this category of headache includes any headache that is the symptom of another physical disease or disorder. Secondary headaches can be caused by such frightening diseases as aneurysms, blood clots, infections, tumors or a high fever, as well as others. Symptoms: there are three main types of primary headaches: tension headaches, migraines, and cluster headaches. Each type has specific symptoms and possible causes. The symptoms of a headache depend to some extent on what type of headache it is. Tension headache, there may be general, mild to moderate pain that can feel like a band around the head. They tend to affect both sides of the head. Migraine headache, there is often severe throbbing pain in one part of the head, often the front or the side. There may be nausea and vomiting, and the person may feel especially sensitive to light or noise. Cluster headaches, these can cause intense pain, often around one eye. They usually happen around a particular time of year, possibly over 1 to 2 months. Does stress cause headaches? Many people believe that headaches are a byproduct of stress. Can stress cause headaches? In a word, yes, at least for some people. Being under severe stress does not result in a headache every time for every person. However, for people that have a predisposition to get headaches, it can act as a trigger for both tension headaches and migraines. Although some doctors now feel that an imbalance in brain chemicals is the root cause of many headaches, the question remains, what is it that causes the headache victim's brain chemistry to go out of whack in the first place? In the case of migraines, we know there is a genetic predisposition for a migraine sufferer's brain to react to stress in a certain way, but what about tension headaches? People who suffer from tension headaches frequently feel a headache coming on during stressful situations at work, or in anticipation of a conflict with friends and family. This seems to indicate that stress can bring on a tension headache, at least in certain individuals. Of course, just because stress may cause some headaches does not mean that headaches are a psychological disorder, or that the pain is all in your head. All headaches, even headaches triggered by stress, are real, measurable physical ailments. Still, learning to deal effectively with stress can be a powerful tool in managing headaches for those people that list stress as a headache trigger. Many different treatment options are available for different types of headaches. Medical treatments can include drugs and even surgery in severe cases. Many drugs have proven effective, but for some people, they do not offer the desired relief. Also, many drugs have side effects. In this chapter, we will look at the different medical options available to treat headaches, and then at natural remedies you can try out at home. Natural therapies can be used either instead of drugs for people who are unwilling to use them or in conjunction with traditional medical treatment. Medical treatments for headaches: analgesics, these are painkillers, either prescription or over-the-counter, which are prescribed to relieve headache pain. They are most effective for tension headaches and mild migraines. Over-the-counter analgesics can include acetaminophen, Tylenol, ibuprofen, aspirin, and naproxen sodium, Aleve. Prescription analgesics include indomethacin, naproxen, and ketorolac-tromethamine. Potential side effects can include digestive disturbances, ulcers, and in the case of acetaminophen, liver damage if the drug is used heavily for long periods. If you are using analgesics to treat chronic headache pain, you may be making the situation worse. Constant use of painkillers can cause what's known as a rebound headache. After the painkiller wears off, the headache comes back with a vengeance. Triptans are a class of drugs prescribed specifically for migraines and cluster headaches, although they can also be used by people affected by both chronic migraines and chronic tension headaches. In addition to relieving headache pain, they can also help with nausea, vomiting, and other symptoms associated with migraines. Triptans work by causing the over-dilated blood vessels in your brain to shrink back to normal size, normalizing the flow of blood in the brain. They also prevent the release of brain chemicals that contribute to inflammation and pain. Triptans can stop a migraine once it starts. Statistically speaking, they successfully stop 80% of migraine attacks. These drugs come in 3 forms: oral, injectable and a nose spray. The injections and the nasal spray are the fastest acting. Potential side effects can include body aches, tiredness, dry mouth, tingling sensations, weakness and throwing up. Rare, but more serious side effects can include a stroke or a heart attack. So, do not pass go and go directly to the nearest emergency room if you feel chest pain or pressure, get dizzy or have trouble breathing after taking triptans. Some common triptan brand names include Imetrix, Maxalt, Emerge, Zomig, Axert, Frova, and Relpax. Midrin combines a blood vessel constrictor, an analgesic, and a light sedative into one package. It is effective for both migraine and tension headaches. Midrin is taken orally. Possible side effects include dizziness, drowsiness, rash, and withdrawal symptoms when trying to stop using the drug. Butalbital combinations. Butalbital is a sedative that is often combined with analgesics such as aspirin or acetaminophen, and sometimes caffeine or codeine. It is used for migraines and severe tension headaches. These combinations are used infrequently due to side effects. Side effects can include rebound headaches and withdrawal symptoms. Oxygen inhalation treatment. Oxygen inhalation is used as a medical treatment for cluster headaches. Pure oxygen is inhaled through a mask for up to 10 to 15 minutes. This often leads to a rapid release from the grasp of a cluster headache. Up to 80% of patients reported relief in trials. As you can see, many different drug regimens can be used to help treat your headaches. However, please remember that only a doctor can tell you if these medications are right for you or not. Natural remedies for headaches. For people who just don't want to use drugs or can't handle the side effects, there are also natural remedies available. These have the advantage of being as effective as drug therapy in some cases, and they are often cheaper than drugs and have fewer side effects. Here is a look at some popular non-drug approaches to treating headaches. Herbal remedies. Long before Western medicine showed up on the scene, people used plants to treat themselves for various ailments. Many of these herbal remedies are surprisingly effective, having been shown to work over centuries of use. In many cases, their effectiveness is now being proven to the Western world in scientific studies. Some of the herbs commonly used to treat headaches include feverfew. This herb is a small relative of the sunflower that looks much like a miniature daisy. It has been used as an anti-inflammatory for centuries in traditional medicine. Feverfew has been shown in several studies to be effective in both the prevention and treatment of migraines. To use feverfew to stop a migraine, take 100 to 300 milligrams of the herb. If you are allergic to yarrow, chamomile, or ragweed, please avoid feverfew because you may be allergic to it. Also, willow bark. Willow bark has been used for centuries to treat pain and inflammation. It is the source of aspirin, and is equally effective. However, willow bark appears to be less likely to upset your stomach than aspirin. Since aspirin can cause Reye's syndrome in children under 16, it is advised to also avoid giving willow bark to them. Valerian, skullcap, and lemon balm, used separately or in combination, these herbs possess both sedative and antispasmodic properties. They can help relax you and help to deconstrict your arteries, restoring proper blood flow to your brain. These herbs are available in the form of capsules, tea, and tinctures. Effective for tension headaches and possibly for migraines. Cayenne. A cayenne pepper solution can be used as a nasal spray to help relieve a cluster headache. However, this treatment can cause pain and a burning sensation in the nose. Talk to a naturopath or doctor to find a suitable preparation. Ginger. Ginger may be effective in treating migraine headaches. There was a case study where a woman who suffered from chronic migraines began taking ginger at the first sign of aura and was able to head off her headache. Ginger has anti-inflammatory properties and is known to help fight off nausea. There currently have not been any standardized experiments done on ginger, but to see if it works for you, take 500 to 600 milligrams of powdered ginger in water. Ginkgo biloba. Although this herb is better known as a memory enhancer, it can also help stop migraine pain. Ginkgo widens blood vessels and helps improve circulation, keeping a normal amount of blood and oxygen flowing to the brain. Coffee. Coffee contains caffeine, which has been shown effective in treating headaches. However, be aware that many over-the-counter drugs for headaches, such as Excedrin, also contain caffeine. Relaxation techniques, meditation and visualization. Another drug-free method of treating headaches is to practice relaxation techniques to help relax your muscles and clear your mind of stress. Some people find techniques such as meditation and creative visualization to be quite helpful in stopping a headache. Meditation is one relaxation technique that has been studied for migraines. In the study, participants who meditated reported experiencing fewer migraines than people who did not meditate. Many religions practice some form of meditation, so there are many different types of meditation. However, they all share a common goal: to help the participant learn to focus their attention entirely in the present moment. By living life one moment at a time, much of the stress that triggers headaches can be avoided or diminished. Although meditation can be part of religious practice for some people, it certainly does not have to be. Many people practice meditation simply to gain greater mental discipline and better control over their thoughts, or to relieve stress. Visualization and guided imagery. Visualization and guided imagery are powerful relaxation techniques. Like meditation, they rely on harnessing the power of the mind to heal the body. However, the difference between meditation and using guided imagery is that meditation is about clearing your mind completely. With guided imagery, on the other hand, instead of clearing your mind, you focus on a set of healing images. For example, some people visualize standing in front of a giant medicine cabinet, choosing a bottle from the cabinet, and taking a pill. The idea is that simply imagining taking a headache pill that you know will work causes the body to behave as if under the influence of the imaginary medication. Thus, your headache goes away. Another sample guided imagery technique is to imagine your headache as a ball of red light that fills up the inside of your skull. If your head is pounding, imagine the light pulsing in time with your pain. Now, imagine that your hands are producing a gentle azure light, like starlight. Bring your hands up to your head, placing them wherever the pain is most intense. Imagine the cool starlight from your hands chasing away the hot red light in your head, and you should feel your pain diminish along with the red light. Hot and cold therapy. Using heat and cold to relieve pain is another natural method of treating a headache. For example, an ice-cold compress applied to the temples relieves headache pain for some people. When the headache is accompanied by pain in the neck area, a warm compress will relax muscles and reduce headache-triggering tension. Alternating hot and cold showers will help increase circulation and may help with migraines. Behavioral changes to reduce headaches. As suggested previously, if you can identify the triggers that cause your headache attacks, it becomes a relatively simple matter to change or remove those triggers from your life to reduce the severity of your problem. However, there are other lifestyle changes that you can make which some doctors believe will reduce the frequency and severity of headaches that many chronic headache sufferers have to contend with. Hence, if you are having difficulty pinning down a specific reason why you suffer chronic headaches or migraine, you might consider making some of these changes to see whether they are effective for you. One such change that many physicians believe will help to reduce the frequency and severity of headaches and migraines is taking 20 or 30 minutes of regular aerobic exercise every day. To a degree, this makes a great deal of sense because taking regular exercise achieves many objectives which, whilst they may not remove or reduce headaches directly, will nevertheless have many benefits, amongst which may be the reduction of tension-type or migraine headaches. For example, if you suffer a tension-type headache because of stress, one of the best ways of working stress out is by running or cycling. Similarly, many people suffer tension-type headaches as a result of anger or frustration, and once again, exercise is a great way of working these feelings out. The concept of exercise as a way of reducing the severity and frequency of headaches makes a great deal of sense on many levels, and if you do suffer, it would be worth starting a program of regular exercise to see whether this helps reduce the problem. Another change that often helps people to overcome headaches is to take more sleep and to do so more regular times. For most people in the modern world, getting enough sleep is never easy, but it is a fact that one of the direct results of a lack of sleep is a headache. Whether your problem is chronic tension-type headaches or migraines, it is often true that sleeping the problem off is a highly effective way of dealing with it, assuming that the pain is not so bad that it prevents you from going to sleep in the first place. As suggested earlier, diet is a very important consideration when it comes to getting rid of headache problems as well. Common migraine and headache trigger foods include those that contain tyramine like red wine, smoked fish, aged cheese and figs, whilst other foods such as chocolate, nuts, peanut butter, bananas, and dairy produce are also known to cause headache and migraine problem. Consequently, you should be particularly cautious with foods of this nature if headaches or migraines are a problem. Other experts suggest that aspartame might trigger headaches and/or migraines in some people, although this has not as yet been conclusively proven. However, in a placebo-based test, it was established that people who were given monosodium glutamate were far more likely to develop headaches and migraines than people given a placebo, hence there is little doubt that MSG can be a cause of chronic headaches and migraines. Another change that can help chronic tension-type headache or migraine sufferers is to break the cycle of the problem. In many cases, when people are a chronic headache or migraine sufferer, the cycle of the condition follows a particular predictable path, and breaking the path or cycle can be effective for reducing the severity of future attacks. As suggested when looking at the situation where your headaches are caused by stress earlier, breaking the cycle involves making a conscious mental effort to step back from the situation when you feel your headache coming on. To do this, having the ability to relax totally whilst breathing deeply will certainly help, as will the ability to practice visualization of auto-hypnosis. In both of these situations, you use your mind to control the way that your body is reacting, effectively telling yourself that the pain is nowhere near as bad as you initially believed it to be. Some people doubt whether visualization or auto-hypnosis can be effective, but the fact is both practices can be learned and mastered, and they are both very effective for reducing the severity of the pain that you consciously feel. Think of it this way. Have you ever noticed that once you have taken an analgesic painkiller, you often feel better almost instantly, although the drugs in the painkiller have not had anywhere near enough time to work? This is a classic example of your subconscious mind controlling the conscious by convincing it that the pain is going away even though the drug in question is not, in fact, effective yet. Massage therapy for headaches. Another highly effective way of dealing with and getting rid of headaches is by subjecting yourself to massage therapy, the gentle kneading and manipulation of your soft bodily tissue to induce extreme relaxation, which in turn helps to reduce pain in many bodily areas. There are dozens of different forms of massage therapy that you can enjoy, and in the USA alone, there are reported to be over 90,000 trained massage therapists, so finding someone to give you a soothing, pain-relieving massage should not be all that difficult. Many studies over the years have reported that massage is extremely effective for dealing with different types of pain, whilst at the same time, it is generally accepted that one of the best ways of reducing stress and tension is to enjoy a relaxing massage. Consequently, if your chronic tension-type headache or migraine problem can be traced wholly or partly to stressful living, it might make a good deal of sense to incorporate a regular massage in your daily or weekly routine. Some massage systems incorporate or include aromatherapy in the program, and it has been indicated that aromatherapy and massage in combination can help to stimulate your immune system as well. Strengthening your immune system in this way could also help to lower the risk of suffering chronic tension-type headaches or migraines, so including aromatherapy in combination with a massage in your bid to overcome your problem is very well worth considering. Keeping a headache diary. Keeping a headache diary is perhaps the most important part of any prevention routine. A headache diary will allow you to keep track of your headaches and discover what triggers them. For example, try to remember what you ate or drank the last time you had a headache. What was the weather like? Did anything stressful happen that day? Chances are, you don't remember anymore, even if it was just a few days ago. A headache diary is crucial because it allows you to write down all of the possible factors that could have triggered your headache. Then, you can begin looking for patterns until you isolate your headache triggers. Start by comparing your headache diary entry with the common triggers for the type of headache you are experiencing. If your headaches don't seem to correlate with any of the triggers mentioned, please start looking for patterns. Look at your entry, and for every day that you had a headache, think, what does today have in common with last time I had a headache? If your headache triggers turn out to be something that's easily avoided, such as a certain type of food, you can consider cutting the trigger out of your life completely. Some triggers, of course, will be uncontrollable factors like stress, or the weather. While you cannot hope to avoid these types of factors completely, once you realize that they are setting off headaches, you can take preventative steps as soon as you are exposed to the trigger. If you like this video, subscribe to the channel and give it a thumb up and share with your friends. Thank you.